Hi, everyone, and welcome to today's event, Growing a Career in Health System Specialty Pharmacy. Pharmacists shared their experiences. My name is Catherine Edwards, and I serve as the Marketing Director at Trellis Rx. Today's webinar is accredited by ProCE. CE credit can be claimed starting at the ProCE website by April 30th. We will announce the attendance code at the conclusion of today's event. Today's speakers have no relevant conflicts of interest to report. Before we get started, I want to share just a few housekeeping items. First, as you heard, this webinar is being recorded. We will share the recording after the event. Second, our goal for you today is for you to leave with information you can apply immediately to your own career. That said, we encourage you to share your questions for our panelists to answer during our time together during the questions panel in your GoToWebinar control panel. Any questions we don't get to today will be addressed in a blog post after the event. Before we get started, we also have a poll question to help us get to know you a little bit better. So I'm going to launch the poll now, and we'll take just a minute or so to answer that. All right, the poll is in progress, so if you all want to share your answers, I will share the results in about 30 seconds or so. Still got some answers coming in, so we'll give it a few more seconds here. All right. So it looks like we've got people here for a whole variety of reasons, but definitely one of the leading ones is to learn how to accelerate career growth in the hospital and health system specialty pharmacy space. We also have some people who are new to their careers or about to start their careers that are here to learn more, as well as people who are looking to move into the hospital and health system specialty pharmacy space. So we definitely have something for all of you today, and we're excited to dive into the event in just a second here. All right, so without further ado, I'm going to just walk through these learning objectives and then introduce our moderator and our panelists. So our learning objectives for today's panel discussion, as you can see, are focused on providing practical information that you can leverage to either transition to a career in the health system specialty pharmacy space or to grow your career in this space if you're already working in it. I think you'll find that our moderator and our panelists today bring lots of relevant insights and experiences that you will find beneficial in your career, and I will introduce them briefly before we dive into the event. So first, we have Denali Cahoon, who's going to serve as our moderator today. Denali is the Chief Operating Officer at Trellis Rx. And in her role, Denali leads all functions focused on enabling Trellis's partner health systems to build and grow health system specialty pharmacies that deliver consistent, high-quality care and service to patients. This includes clinical affairs, accreditation and quality improvement, site execution, talent acquisition and management, and more. Prior to joining Trellis, Denali led operations at Apothecary by Design Specialty Pharmacy. And now our panelists. First, Brandon Newman. Brandon is the Vice President of Clinical Affairs at Trellis Rx, where he is responsible for leading Trellis's team of expert clinical resources and managing industry relations with pharma and other stakeholders. Brandon has been working in specialty pharmacy since 2003, spending time at Accredo and at Vanderbilt University Medical Center's specialty pharmacy before joining Trellis. Brandon is actively involved in the specialty pharmacy community, serving as the president of the Specialty Pharmacy Certification Board and as a board member at NASP. All right, now Suprina. Suprina Patel is a clinical pharmacist at Trellis Rx. As part of Trellis's Atlanta-based team, her focus is on providing expertise and support to Trellis's specialty pharmacists serving patients with autoimmune conditions at health systems across the country. Her broad responsibilities include leading our inflammatory disease subcommittee, developing clinical protocols, supporting site operations, and more. Before joining Trellis, Sabrina served as a clinical pharmacist at Encompass Rx, an independent specialty pharmacy. Jason Trokey serves as the Director of Customer Success at Trellis Rx. In his role, Jason is responsible for leading the implementation of specialty pharmacy services at Trellis Rx's partner health systems. Jason began his pharmacy career at Walgreens, where he gained management experience leading traditional brick and mortar retail locations as well as on-site health system locations. Before joining Trellis, Jason also led operations of an independent specialty pharmacy across 4 states. And last but not least, Casey Ross. Casey is the Clinical Operations Manager for Trellis at Southern Ohio Medical Center in Portsmouth, Ohio. Casey's responsibilities include leading the day-to-day operations for SOMC's specialty pharmacy service, including managing a team of on-site pharmacists and pharmacy liaisons. Before joining Trellis, Casey served as an ambulatory care pharmacist in internal medicine at Marshall Health. So with that, I'm going to stop the screen share so that y'all can see our panelists and pass it over to Denali to begin our event today.
Thank you, Catherine. And welcome everyone to today's panel discussion. We're really excited that everyone has joined us. You know, if you are considering transitioning to a career in health system specialty pharmacy, we hope that you leave today's event with the information that you're going to need to position yourself for success. And if you're already working in health system specialty pharmacy, we hope that today you'll gain some insights about how to accelerate your career and to achieve your professional goals. So with that, I want to kick off and get started. And my first questions are for Jason and Sabrina. So Jason, you have both worked in different practice settings before transitioning to health system specialty pharmacy. So maybe if you could briefly describe your career journey and tell us how your roles in other practice settings eventually prepared you to transition successfully into the health system specialty pharmacy setting.
Sure, thanks, Denali. Retail pharmacy helped me to become the leader that I am today. I managed more pharmacies and team members that I could put a number to off the top of my head, but I'd say confidently that it was double digits for locations and very likely triple digits for number of team members that had reporting to me over the course of my time in retail. I was on this path of being kind of the designated fixer that maybe some of you that have joined us today may currently be on. Really kind of tasked with turning underperforming stores into ones that performed a little bit higher and in line with the company's outlined goals. And, the ultimate reward that I got for that was typically another opportunity and another reclamation project. It was always my goal to be elevated into a position where I could affect change on a broader scale than within the 4 walls of the individual location that I had been working in. And eventually, that attempt to try to work towards a promotion and additional responsibility led me to an opportunity to be the pharmacy manager on site at a specialty location in my area. I really pounced on this opportunity despite the fact that, I took a pay cut to move from the location that I was at to this specialty area, or to the specialty pharmacy embedded within the health system, because I knew that it would give me more solid footing in my career and for the future. This opportunity to see a little bit more of the specialty side really confirmed my thought process and validated my suspicions that, I wanted to move into specialty pharmacy on a larger scale. And the easiest way for me to do that moving forward was to leave the comfort that I had with my, large company background and 10 years in that particular, with that particular company, and move into an independent setting. I thought when I made this transition that I knew what it meant to be a specialty pharmacist. I most assuredly did not. The majority of our providers came from small offices with a few large health system affiliations, and the physicians that came from the large health system really, demanded more from our team than I was typically used to, but we were always able to deliver to these providers and eventually ultimately their patients. And I really respected that. And that, gave me a look behind the curtain as to what it would be like to be involved in a health system embedded specialty pharmacy model. My transition to this model was one that happened almost entirely due to factors that, were out of my control. As has happened with many independent specialty pharmacies and independent pharmacies in general in recent years, big fish tends to eat little fish, and ultimately, the owners of my company decided that they were going to cease operations, sell the business to CVS Caremark, and proof positive that specialty pharmacy world is really a small one. Our very own Sabrina Patel took over a portion of the autoimmune patients that we had previously managed at my business in Florida. So I knew that I wanted to continue to move forward down the path of remaining in specialty pharmacy. And it was not a transition that, coming from a job that I worked 40 to 50 hours a week, I didn't think it was going to be difficult to re-enter, to get back into the workforce. For about 7 months after my company ceased operations, my business card would have read stay-at-home dad and aspiring but failing PGA Tour member. I played a lot of golf, I read a lot of books, and that was my time that I really wanted to find the right position with the right company. And some of that longer period was because of how difficult the market is and remains right now. But I'm a testament to say that, if you're willing to be flexible, if you're willing to kind of step outside what might be your comfort zone, I think that it would really benefit a lot of people to kind of stretch what they think that they can do and how they think they can do it. That's what I did. That's where I'm at, and I'm very happy for it. So thank you all for listening to my story.
Yeah. Thanks, Jason. And, I think a lot of the challenges that you experienced in both the retail and the independent specialty pharmacy industry, your experiences and those challenges, I'm sure that they're going to resonate with a lot of our audience members today. So thanks for sharing that and how you ultimately successfully transitioned, parlayed those experiences to a successful career in health system specialty pharmacy. Now, Sabrina, you also, came from an independent specialty pharmacy background. Can you share a bit about your experiences and how you've been able to translate that into success in health system specialty pharmacy?
Yeah, absolutely. Thanks, Denali. So similarly to probably everyone on this call, I didn't really know what specialty pharmacy was until it kind of fell into my lap. I started off during a P4 rotation, so an APPE rotation, and I just happened to have a specialty pharmacy on my rotation list, and I had no clue what it was, but I was very, very excited for the opportunity to learn something new that I didn't learn in pharmacy school. After I had my short 5-week rotation, I decided to take a full-time job with this company. And I was pleasantly surprised at all the clinical knowledge that I gained throughout my 5 years there, or 4.5 years there. I was wearing a lot of different hats when I was in the independent position. I learned a lot of different disease states and disease specialties. I definitely was able to a lot of different practitioners and providers, and I was able to do things that, typically people in the pharmacy field don't do, such as, marketing or delving within different fields and new opportunities within specialty pharmacy. So that was very interesting and very enriching for me. Having that independent specialty pharmacy background definitely benefited me in this position by being able to understand and hit the ground running of the specialty pharmacy infrastructure and able to make myself more of a specialty pharmacy workflow expert and industry expert. But also it allowed me to see the similarities and differences between the two. So health system specialty pharmacy has a lot more insight into the patient's case. You're able to be more of a care team member. Whereas independent specialty pharmacy has a lot of ability to grow geographically and into different disease specialties, not limited by what is provided or what is offered at the health system. So they're definitely very different beasts, but they definitely pair off of each other. So one big thing that I feel like I learned from my independent my time in independent was becoming a self-starter and a workflow expert. So I don't think I would be able to succeed as much as I do here at this company without learning to kind of juggle many different disease states and projects at my previous position. So managing provider and insurance expectations. So for instance, when as specialty pharmacists, we're always performing a balancing act for all the different key the different key options in our field. So for instance, insurance coverage versus provider preferences versus our protocols and outside specialty pharmacies. So I think it's all a big balancing act, and I don't think that I would have been able to do that effectively here in the health system setting had I not had the experience in my independent career.
Thanks, Sabrina. I love how you were able to take your experience as an appy and then, grow in that experience at the independent specialty pharmacy and now use it as a springboard as your career has really grown. So thank you. Now, Brandon, you've also worked in many different practice settings throughout pharmacy, whether it's, retail or different specialty pharmacy settings and now in health system specialty pharmacy. So can you maybe give us your perspective on really what differentiates health system specialty pharmacy from either independent or retail specialty pharmacy?
Yeah, thanks, Denali. So I have had the opportunity to work in a few different specialty practice settings, and maybe the one I should start with is retail pharmacy. I spent some time as an intern and a pharmacist in retail, and I'm a strong believer that some retail experience makes you a better pharmacist all around. You never know what kind of situation you're going to run into next, so I think it really helps develop problem-solving skills. And while working retail, I would occasionally fill a specialty medication, like maybe a Humira, but I wouldn't really consider that to be true specialty pharmacy experience. You may dabble in it a bit, but it's really hard to understand what true specialty pharmacy is. With independent specialty pharmacy, which was my first experience with true specialty, it's where I had my start. And I think the differentiator is that there's a big focus on high-touch services with independents, but so many of them are being acquired by CVS and Walgreens. I know Jason and Sabrina spoke a little bit about that. And that may sometimes become diluted with the high-touch services that patients are used to with independents. Not that they're not doing a good job, but I think it's just easy to lose that mom and pop feeling when you're acquired and you grow so big so quickly. With PBM-owned specialty pharmacies, you have the ability to impact a large number of patients, which I think can be really interesting. Have an opportunity to talk to patients across 50 states, and you get to see a lot of interesting things clinically. But it's easy to lose that personal touch. Once again, at least from my experience, what I found is that we were so big that you may not have the opportunity to talk to the same patient more than once, ever. So the last segment I would touch on would be health system specialty pharmacy, which to me, that's been the most rewarding practice setting in my specialty pharmacy career. And I think a big part of that is because you have access to the full electronic health record, and also you're working side by side along the physicians and nurses. And those are all things that I think most of you who don't work in that health system setting can really relate to and say that, it'd be really nice if you had access to those things. It just makes caring for the patients a lot easier. And it's also unusual in specialty pharmacy to be able to meet your patients face to face, especially when you're helping patients across a broad region or, across the U.S. But working in health system specialty pharmacy allows you to see the patients when they come in for their clinic appointments. So essentially, you're seeing the patients oftentimes as many times as the physician does throughout the year. You may be talking to them more often than the physicians because of the touch points you have in between on the phone. So it really allows you to develop some long-standing relationships with the patients. Health system specialty pharmacies just allow you to build those relationships so much more easily, I would say. And you're able to see the big picture of what's really going on with the patient. And by having access to the full medical record, it really allows you to tailor the care you're providing them.
Thanks, Brandon. That's really helpful. It's thinking about what that embedded care model really means in a health system specialty pharmacy, being able to be at elbow with the provider as part of the care team and work closely with the patients and the provider. That's really helpful for us to understand. Now my next question is for Casey. Casey, you actually began your career in a health system setting, maybe not necessarily in specialty pharmacy. So what top experiences would a pharmacist need to succeed in a health system setting, and how could they gain those experiences in their current role?
Yeah, absolutely. So I began my career as a pharmacist, as mentioned, in a health system outpatient pharmacy, which we provided retail services 24/7 to patients of our community. We dispensed specialty medications to patients at the health system clinics and then provided med-to-bed services for those inpatients who were being discharged. And then transitioned into an ambulatory care setting, which I worked in internal medicine prior to my role in specialty pharmacy. And so when I think about being a clinical pharmacist in the health system specialty setting, there are a couple different avenues to be able to obtain such a goal. One is by completing a PGY1 or PGY2 residency program with an emphasis in the area of interest. But as we all know, due to the number of applicants per year and the number of positions that are available, so this isn't always an option for everybody wanting to pursue that clinical position. I personally did not complete a residency program, so I really kind of want to discuss some areas of involvement which led me to specialty pharmacy. And you think about the goals of residency programs, and that's to provide additional training and to enhance one's areas of expertise. But there are also many other ways that this can be accomplished. So a couple things that I think about when wanting to evolve more into this realm is continually to stay involved, to gain additional knowledge through many avenues, such as national and state organizations, community outreaches, certificate programs, and conferences that you can attend. A couple that I think of that I completed certificate program-wise is through ASHP and APHA. They offer certificates and expertise of medication therapy management, cardiovascular disease risk management, and pharmacy cycle revenue. But also investigating opportunities within the own health system that you're involved. A lot of health systems are patient-centered medical homes or accountable care organizations, which have a lot of involvement with Medicare or employee population initiatives. And a lot of those can tie over into different realms, such as you've heard us talk about retail or into specialty pharmacy. And when I think about, individuals and the amount of experience that they've obtained throughout the years and wanting to highlight that, one of the biggest things is, an integral piece of advancement is ensuring that all your hard work and accolades are being highlighted when you're applying for positions with a prosperous employer. So thinking about it being your first impression, you want to make sure that your CV is neat, error-free, formatted consistently, but really highlighting those sections above that we talked about. So conferences you've attended, the volunteer and community involvement related to pharmacy, certificates you've obtained, presentations you may completed, or even preceptorships with local schools of pharmacies, to be able to set yourself apart from other applicants that may have some other experience already in that area.
Yeah, thanks, Casey. I really love that you highlight that there are multiple paths to reach career advancement in health system specialty pharmacy. You certainly can achieve that through a residency, but there are other ways to gain the experiences and the the credentials that would be necessary to be noticed by a potential employer. So thanks for pointing those out. And speaking of trying to set yourself apart on a CV, Brandon, I know that you have reviewed many CVs in your day as a hiring manager at a number of different positions. You've hired many pharmacists. So, when you're evaluating a pharmacist and thinking about either hiring them or you're thinking about promoting them into a different position, obviously you're looking at their experiences and you're looking at the skills, you're looking at a number of the things that Casey pointed out. But above and beyond those, what characteristics are you looking at, or do you think that employers are looking at when they're doing hiring or they're thinking about promotions in health system specialty pharmacy?
Yeah, I would say my favorite thing about working in a leadership role in specialty pharmacy is having the ability to build great teams. And I think building great teams really starts with hiring great pharmacists. And, in the process of doing that, I've had the opportunity to look at a lot of resumes and had a lot of interviews with pharmacists, and eventually went on to hire a lot of those pharmacists. And one thing that, occasionally I'll run across is an applicant who has experience in specialty pharmacy. That's becoming more and more unusual. I feel like that we run across that, and even more rarely, I'll run across someone who has health system specialty pharmacy experience, which again is kind of a rare find. And what I'm finding is that more often these days, I'm really looking for someone that can be developed into a great specialty pharmacist. And, when I think about that, a lot of the applicants that we get are in retail settings and, trying to break through to a job in specialty pharmacy. And one thing that I really appreciate is when those pharmacists can give me examples of, what I would call outside the box business growth opportunities that they've seen or developed themselves and been able to carry through on. So one example that I'll give you, I'd like to use this example. There's a pharmacist that we recently interviewed and went on to hire. And this pharmacist had not been out of pharmacy school too long, and he'd been working in a retail setting. And he was challenged to meet a flu shot quota, and he knew that he was not on track to meet that for the year. Some things had happened that were hindering that for him, and he literally created a mobile flu shot clinic on a cart and signed up a few large corporations, employers in his area, and he went on to administer their employee flu shots. He was literally going cubicle to cubicle, giving these shots, and by doing that and thinking outside the box, he was ultimately able to exceed the goal that he had, and was actually one of the number one in his area. So I think those business development skills serve you well when trying to grow and maintain business in specialty pharmacy, because it's such a competitive environment. A lot of people really pulling for that patient's business. Another thing I always look for is candidates with great soft skills. So people who may not work in specialty pharmacy, but have found creative ways to, make an impact on patients. And another example I'll share here is I worked with a pharmacist who worked at a retail setting that wasn't extremely high volume. And, she was always looking for ways to grow her business and help more patients. And there was a local assisted living that would put patients, on a bus and take them to the grocery store, which is what this retail setting was, a couple of times a week. And those seniors would oftentimes end up at the pharmacy, either needing help with OTCs, or occasionally they'd fill a medication. And this pharmacist went on to really build a strong relationship with those seniors, and actually began visiting the assisted living on a weekly basis, and set up a program where she would deliver medications to that assisted living, and help patients, with their med list, and do some brown bag clinics, where she would explain to the patients, why they're taking this, and some things that they could really do to optimize their medication regimens. So, I think that just thinking outside the box, things that you don't typically think about being able to do in retail, sometimes you may be able to find opportunities that a future employer would see as being very innovative and valuable. Another thing, I think being a good listener is probably, to me, the most valuable soft skill. So there have been candidates who may not necessarily stand out on their resume, but once they make it to the interview process, they absolutely crush it. I'm always really impressed by a candidate that I feel like has listened to what I say. And some ways I know that they're listening is, especially if they haven't worked in specialty before, I'm giving them a lot of information, explaining, what specialty pharmacy is, what we specifically do in the setting that we work in. And when they ask really good questions or repeat things back to me in a way that let me know that they heard and understood what I'm saying, and, not asking things that I've already, questions I've already answered, to me that really relates well and really shows their ability to learn quickly. And that's one thing that really ties back to patient care as well. Just being a good listener. I think those are things that serve you well in these clinical settings. Another soft skill I would talk a little bit about would be empathy. So I think that that's a soft skill that we find very important. And, I think it's especially important in specialty pharmacy and the chronic conditions that we're working with, because it's not uncommon that these patients may be having the worst day of their life. They may have recently received a terminal diagnosis. They may have cancer or HIV, and you just really never know what those patients have been dealing with. So just understanding that they may be having a really bad day, and you have the opportunity to really make that day a little bit better for them. The last thing I would comment on would be involvement in industry groups like National Association of Specialty Pharmacy, and AMCP also has a specialty division that they're growing even more recently. And I think attending those conferences is a great way to really stay in the know and be able to network. I think that specialty pharmacy is such a small world, and I can think back on people that I met early in my career at conferences that I never actually worked with, but I've stayed in touch with them over the years, and we'll email back and forth when a conference is coming up and grab lunch or coffee, and those are a great way to really just keep the networking up and know when opportunities may be coming available.
Thanks, Brandon. I'm sure that you talked about listening as an important soft skill, and I'm sure that our audience members, who are all great listeners, are all thinking about ways that they can take that idea of doing a mobile flu shot clinic and putting into their practice, because that was a great story. I'm going to have to figure out which team member that was. I love that. All right. So this question is actually for Casey. So Casey, some of our attendees already work in health system specialty pharmacy setting, and they may be interested in how to grow their career and do some professional development, which you've been very successful at, Casey. So what paths are available to health system specialty pharmacists who are looking to advance professionally?
Yeah, thanks, Denali. So as I previously discussed, and a lot of what you've heard the others speak to, is really remaining up to date and involved in the ever-changing world of pharmacy. Within the specialty pharmacy realm, there's kind of two buckets which I place areas of advancement in, one being on the clinical and the other on more of a managerial side. I am actually now, as you heard from my introduction, more in the managerial realm, and serve as the clinical operations manager at our on-site location by working with our own team of pharmacists and liaisons to work daily to provide optimal patient care to the clinics we serve, along with being an on-site leader for our specialty pharmacy services within the health system. And as we talked about the transition to health system specialty pharmacy and the different paths which can take place, there are numerous routes to be able to advance your career within the health system specialty pharmacy. Again, I'm going to talk a little bit about my own, in which I completed my Master's of Business Administration in Management after being a licensed pharmacist, and really just focused on, after obtaining that base knowledge, on being involved and encompassing traits as a leader within my own organization. So it's key, no matter whom you're working for, to show that you have the initiative to grow both personally and professionally. Being a mentor and a leader for individuals working in the same space daily, even if it isn't an official title, as a pharmacist or an upcoming pharmacist, we are all leaders in some sense with our day-to-day duties. Along with being an effective communicator to all the stakeholders within your organization, being able to talk about ideas or opportunities or problems effectively are really important in my day-to-day role. I've also really held true to the statement when thinking about my team and the management of them, is treating my fellow colleagues the way that I would want to be treated. It's something that many of us are taught at such a young age, and I try to hold true to that when thinking about those that I work with day to day. There's really no perfect path to the advancement or known time that it's going to take for everyone to be able to get there. But again, just making sure that you're being open to new opportunities is really a major player to everyone's success.
Thanks, Casey. And you started off by pointing out that there may be multiple pathways to professional advancement. So it's not a one-size-fits-all. And team members, they may focus more on developing clinically, or they may focus more on developing their administrative or managerial skills. Jason, you certainly have pursued, more of the administrative and managerial path. So, what types of opportunities would you recommend specifically that pharmacists go after if they're interested in pursuing this path specifically?
Yeah, thanks, Denali. So the short answer to that particular question would be that you need to find a way to set yourself apart from what seems to be a very, very large crowd. My co-panels here have kind of detailed a really nice way to be involved in more additional opportunities that you have to be mentor, to develop an outside the box thinking. But for me, it was always about wanting to make sure that my superiors, whom ultimately would be the folks that would, kind of prop me up for additional advancement within my previous organization, saw that I was willing to take on additional responsibility. And then once I had succeeded with that, I was always asking for more. It's very likely the expectation based on my experience and the feedback that I get from my, former colleagues that are still in the retail space that, the expectation is always that you do more with less. But if I'm being honest, that's a standard, and that's not really enough to stand out. For me, some of the things that I did were, kind of seeking out opportunities to be involved with initiatives that were broader than maybe my individual store, improving performance there, or even at the district level. I tried to helped to organize the summer internship program and was very involved with local schools of pharmacies as a preceptor, participating in some of their reaccreditation channels. Find out a way to impact change on a broader scope through maybe regional MCM programs that your company may be running, or determine if something like attending legislative days with the cohort that your company may be sending for to lobby a certain initiative, whether it impacts the pharmacist to technician ratio, or mandatory lunch breaks that would be required, things that potentially can impact you on a personal level, but more broadly the company that you work for and the profession in general. If that's not something that your company is currently sponsoring, ask if you can go. And if you can go, make sure you come back and share your experiences there so that your voice is heard. The obvious things around obtaining certifications, becoming an immunizer trainer, certified diabetes educator, compounding, HIV, these things are, very accessible to retail pharmacists. But, having tangible accomplishments, both at the micro level of your store and the macro level of your company, on a district or regional level, are going to be things that you can use to leverage, both internally within the company as you advance and externally for positions as you move on. As we are all obviously resistant to change, it will very likely need to be that you step outside that comfort zone to get where you need to go for the advancement of your career. And again, happy to say that I did. I'm a better person and a better employee for it.
Thanks, Jason. Yeah, I think it is so critical. It sounds so simple, but asking for the experiences, asking for the exposure, and then ultimately making yourself indispensable. It's you've obviously done a great job of that. Now, Sabrina, you have taken more of a path for advancement that's dedicated more towards honing your clinical craft. So what steps would you recommend for pharmacists that they take if they want to pursue a career development that's more focused on deep clinical expertise?
Sorry, I was having some audio difficulties there. So in terms of clinical expertise, I think that it's really important to be able to hone in on your interests regardless of your role. So being honest about what exactly interests you, and kind of being open with that as well, because you'll be surprised at what might interest you. Stuff that just kind of falls into your lap, or your manager asks you to do a project and you jump on it and it ends up becoming your passion. So just kind of being open and honest with yourself and kind of hone in on that interest fully and focus. Also, to continue to keep yourself educated about new medications, their mechanisms, how they fit into guidelines, and where they fit into insurance formularies. I think it's really important, especially in your own disease, your disease expertise or your disease interest, to kind of continue to keep yourself educated about those things, as well as keeping yourself educated about pipeline medications. When we're talking about specialty pharmacy, we're talking about things that are changing every day. So keeping yourself in the know about those types of things is really important. And then finally, I think that I didn't really realize how important this was to me until I came here. But having a mentor or colleague in the field that you can rely on to collaborate or to bounce ideas off of, I think is very, very important. So we have a official mentorship program here at my new company, but previously, I had mentors that didn't even know that they were my mentors. I still currently have mentors that don't realize they're my mentors. And I think that it's great to be able to ask people who are maybe 2 or 3 years or 5 or 6 years ahead of you in their career, what happened at this stage of their career? How can you better yourself in certain aspects? And then, of course, whether or not you can collaborate them. So for me, I have mentors or colleagues that are MDs or PAs, pharmacy technicians, nurse practitioners, and PharmDs, and kind of making sure that you have an open network of people who you can rely on, I think is incredibly important. And I think we were kind of talking about this before, but attending maybe conferences or speaking engagements or things like that to open up your network. If you work in a smaller facility or you work in a place that doesn't have an official mentorship program, could also be another option for that.
Yeah. Thanks, Sabrina. I love that you bring up mentorship. It's so critical, and depending on where you are in your career, you can serve as a mentor, you can be a mentee, it can be official, it can be unofficial, but it's something where you can benefit from it, you can pay it forward. So that's a great concept. Now with that, it looks like we're going to open it up to audience questions. We have a few already, so please feel free to continue to submit, but we're going to start with one right now. Actually, I'm going to kick it back to Sabrina. This one's for Sabrina. Sabrina, now the CSP credential, Sabrina and Brandon, the CSP credential, is that important for someone pursuing a career in specialty pharmacy? And if so, how can I learn more about the requirements for obtaining?
Sabrina, you want me to take this one and you can chime in if you want? Yeah, so what I would say about the CSP credential is, it's something that is an opportunity to do something a little bit different than your traditional BCPS or BCOP, and something that may be a little bit more relevant to specialty pharmacy specifically. So it's a little bit more broad, and I think does a nice job at really gauging your competency and specialty just in general. So, thinking about how this has grown over the last few years, I think I just saw something maybe on LinkedIn from NASP where they were saying that a critical milestone was just hit where there are now 1,000 pharmacists that are certified specialty pharmacists. So that benchmark of 1,000 has just been obtained, or that milestone. And, a couple other things I would say about it is that I've actually, in some preferred payer network agreements, I've seen a requirement that the pharmacy staff have a CSP on staff. So just finding that it actually is making it to some business growth applications that we're starting to see. And, I've actually recently seen it as a preferred qualification in a few job postings. So, to me, it does have some importance, and, I would encourage everyone to take a look at it. It's easy to find information on it. You can go to the NASP or National Association of Specialty Pharmacy website, And there's a link where you can click on learn more about the CSP, and a quick Google search will take you right to the page where you can see the qualifications in terms of experience and education hours and those things.
Thanks, Brandon. Now, since you mentioned that some payers are requiring CSP, and we all know payers are going to continue to raise the bar for access, we had a question come in that says, I'm interested in gaining experience in supporting payer and LDD access initiatives. So what practical steps would you recommend that I take to gain that experience? Now, Brandon is our market access guru. So what practical steps would you recommend to somebody if they want to learn about market access, either LDD or payer initiatives?
Yeah, I would say that to me, the market access on the manufacturer side is a little bit more easy to get into. And I think that starts with a lot of it's just networking and, figuring out which manufacturers have drugs that are interesting and may have a limited network, really understanding, you can find some good articles to read. And, for the person asking this question, if you want to reach out to me later, I'm happy to share some articles with you explaining a little bit about reasons that manufacturers limit those networks. But I think just finding people on LinkedIn is actually a great way. You can look for, typically if I'm going to search for someone, I'll look for market access, or sometimes some of the brand leads for some of these manufacturers and medications, and just ask for a meeting. For me, I feel like pharma has definitely been my friend. I've had a great conversation with a lot of people that, they'll be pretty forthcoming in what's needed there. One thing that I'm finding for some of these agreements is accreditation of the pharmacy is a big requirement and a growing requirement. So that's one thing that you may want to read up on a bit. Now, on the payer side, I would say this one is a little bit more difficult because, there's been so much vertical integration recently with, some of the PBM-owned specialty pharmacies really kind of dominating in that market because you have to go through the PBM to submit some of those network participation applications. So for that piece of it, I think it's really starting with the pharmacy that you're trying to fill the medications at. And then, typically if you try to fill a claim, you'll get a rejection. Sometimes you'll have a fax that will come across that will tell you instructions for what you should do if you want to get in network. And then it's really just working through the application.
Thanks, Brandon. Now we had a question come in about what does a specialty pharmacy team look like? So Casey, I'm going to ask you to take that one. What does a specialty pharmacy team look like? What does your team look like?
Yeah, absolutely. So I think it's going to differ a little bit depending on the size of the health system that you're embedded in. But for our team here, we actually have 3 clinical pharmacist staff that serve our different clinics. We're embedded into 6 different specialty clinics without the health system. So for instance, oncology, neurology, pulmonology, dermatology, to name a few. We have a team that works in the heart and vascular clinic, and one now that we've started launching our chronic disease management services. We also have a pharmacist that focus on those, which encompass diabetes, hyperlipidemia, and COPD and asthma. Our clinical pharmacists are great. They provide that extra educational piece to our patients when starting a new medication, along with continual education and follow through. They follow up if there's any interventions or if the patient's experiencing any side effects, and really work hand in hand with all members of the healthcare team to make sure that the medication is safe and effective. But some of the key players in the STAR staff, I feel like, in our teams are our liaisons. So I actually have 6 liaisons, or pharmacy technicians, that work alongside the pharmacists throughout the clinic to really help obtain the medication. So they work through prior authorizations. They obtain any financial assistance if there's any barriers to the medication being able to afford the medication. And again, work along with the pharmacist to make sure the medication is safe and effective by helping them gather medication records on the patient or collect any sufficient lab work that is needed. So again, we here have 3 pharmacists in 6 technicians along with myself who's on site and help the team day to day with all the duties and responsibilities.
Perfect. Thanks, Casey. Now, we also received a question asking for a bit more information about the managerial path. So it says, I'm interested in the managerial path. What 1 or 2 actions can I take to develop and show leadership potential? Jason, will you take that question and talk about some specific actions to demonstrate leadership potential?
Sure. So, as I mentioned earlier, finding a way to have definitive outcomes to the project that you take on at a level that is higher than the 4 walls of your pharmacy, to me really indicates that you are capable of leading a team and are capable of driving results, because ultimately we're all judged based on the results that we put forth, but leaders more so than individual pharmacists at the store level or liaisons and technicians that are working within a specific disease state are, the proof is in the pudding, as they say. And if you can take on an initiative, from my perspective, that impacts multiple sites and can cross different disease states, that is repeatable and scalable, as we like to say, then ultimately, to me, that is the number one thing that you can do to show leadership, as well as motivating a team. Taking a team that is underperforming for maybe potentially a lack of resources, ability, understanding, and motivate them to elevate them from either low performing or just meeting standards to becoming a high performing team are some of the things that in my past have successfully sort of showed that I was capable of, again, taking on those additional responsibilities. And once you can prove it once, hopefully you can prove it multiple times. And to me, that is the way in which you can be identified and repeatedly looked to as a leader.
Perfect. Thanks, Jason. So we have one final question that I'm going to have the panel answer. And then if there are additional questions, just a reminder that we will answer them in a blog post after the event. So the final question that we will answer today, somebody asked about outcomes initiatives. So Brandon, as our VP of Clinical Affairs, can you talk a little bit about outcomes initiatives in the health system specialty pharmacy space and share some ways to get involved in this type of work?
Yeah, I would say probably starting with some of your low-hanging fruit things that if you're working in specialty pharmacy, you're already measuring. I think that when we think about clinical outcomes, a lot of it really ties back to some of those surrogate markers for a good outcome. So, the patient needs to get started on the medication quickly. They need to be able to afford it, and they need to stay on the medication without gaps in therapy. So if you can look at measuring your turnaround time, the amount of financial assistance that you're able to obtain for the patient, and what their adherence looks like, whether you're using medication possession ratio or proportion of days covered. I think those are some good ways to kind of get into it. So I think, step one is making sure that your patients are getting medication quickly, staying on it, and then what sort of outcome are you looking for? And I know that's kind of hard to measure in specialty pharmacy for a lot of disease states because a lot of them aren't curative. It's really easy to measure that in Hep C when you have an insight and you're going to be curing therapy and you can see what percentage of patients are cured. But for a more chronic condition like multiple sclerosis or rheumatoid arthritis, where really your goal is to slow the progression, you may need to get a little more subjective in some of the things that you're looking for. So I would say consider implementing some patient-reported outcomes, see if there are any standardized tools that are available on the market that you can deploy to your patients. And that's a good measurement of seeing how your patients are feeling. There may not always be a lab value or a clinical marker to tie it back to, but really how patients feel and is a big thing. And then the last thing that I would comment on is patient satisfaction. So how does the patient feel about the services you're providing? Because what I've found in my experience is that even though as clinicians we want patients to have the best clinical outcomes, sometimes patients really just care more about really good customer service, availability, friendly staff, and cost, ultimately cost. So finding a way to poll your patients, whether you do it internally and, maybe you start small and just use a Survey Monkey that you email to the patients. And then, there's also a couple of different vendors where you can have a third party deploy those satisfaction surveys. I think that's another good measurement. So I think those are some of the starting points. You can go really deep in a lot of different areas, but those would be some ways to get your feet wet.
Thanks, Brandon. I love that. So if you want to start with outcomes initiatives, you just have to start, even with the low-hanging fruit. So with that, I'm going to pass it back to Catherine Edwards to wrap us up.
Thank you, Denali, and thanks to all of our panelists for your participation today. I'm going to quickly close out today's event with a final poll question, which I'll share in just a moment, and then I'll walk through the instructions on how you can claim CE credit for attending. So first, let's start with the poll, and we're curious to hear today if you're interested in jobs in the specialty pharmacy space and health systems, or if you're looking for more professional development opportunities in this space as well. We'd love for you to give us a yes or a no here. So I just launched that poll, and I will remember to close it this time. Thank you to everybody who flagged that earlier. We'll give this a few more minutes. All right, we're at about 80% now, so it looks like overwhelmingly people are interested in learning more about this space and jobs in this space, which is about what we expected. So thank you all for being here today to gain insights on how to do that. I'm going to close the poll now, and I'm going to move over to the instructions for CE credit. So you should all be able to see my screen now and to see the instructions for how to claim CE credit. You're going to start this process on ProCE's website, and we've provided the URL on the screen for you. We'll also share these instructions in an email after the event, so if you don't catch this now, don't worry, it will be coming your way in the next few days. You do have until April 30th to claim credit, and the code that you will need to use when you go in to take the post-assessment is AHYNYY. And again, that's AHYNYY. That will be provided in an email. So if you didn't catch it or you're not sure what I said, you'll have that in your inbox soon. All right, the last thing that we want to ask today is for your feedback. So when you close out of the event, you will get a 3-question survey, super short and sweet. But we would really appreciate it if you can complete that to share your thoughts on today's events, to share thoughts with us on how we could have done better, and what you want to hear about in the future. But thank you all again for joining us today. We're honored to have you, and we hope to have you on a future event sometime later this year. But thank you again, and have a good afternoon.